Transverse myelitis is an inflammatory disorder that affects the spinal cord, causing a wide range of neurological symptoms. This comprehensive guide aims to delve into the causes, symptoms, diagnosis, and treatment of transverse myelitis, while also providing insights on how to manage and live with the condition. Transverse myelitis is a rare and often severe condition where the spinal cord becomes inflamed. This inflammation can damage or destroy myelin, the fatty insulating substance that covers nerve cell fibers. This damage interrupts communications between the nerves in the spinal cord and the rest of the body, leading to a host of neurological problems. The exact cause of transverse myelitis is not always clear, but it is often associated with autoimmune disorders, which occur when the immune system mistakenly attacks the body's own tissues. It may also develop as a complication of viral infections, bacterial infections, or more rarely, following vaccinations. Certain autoimmune diseases, like multiple sclerosis and neuromyelitis optica, are known to predispose individuals to episodes of transverse myelitis. Symptoms of transverse myelitis can develop over several hours to a few weeks, typically affecting both sides of the body below the level of the inflammation. Common symptoms include sudden or gradual onset of lower back pain, muscle weakness in the arms or legs, sensory problems like numbness, tingling, or loss of sensation, bladder and bowel dysfunction, intense sensations of coldness or burning. Diagnosing transverse myelitis involves a combination of clinical evaluation, magnetic resonance imaging, MRI, scans of the spinal cord, lumbar puncture, spinal tap, to analyze cerebrospinal fluid, and blood tests to rule out other conditions. Treatment for transverse myelitis typically begins with medications to reduce spinal cord inflammation and manage symptoms. These may include steroids to decrease inflammation, pain relievers for discomfort, and medications to address muscle spasms and bladder control issues. In some cases, plasma exchange therapy is used for patients who do not respond to steroids. Rehabilitation plays a crucial role in managing transverse myelitis. Physical therapy helps to improve muscle strength, mobility, and coordination. Occupational therapy may be necessary to assist individuals in performing daily activities, and psychotherapy can help in dealing with the emotional and psychological impact of the disease. Living with transverse myelitis can be challenging. It is important for patients and their families to seek support through community resources and support groups. Educational resources can also help patients understand their condition and advocate for themselves in medical settings. Transverse myelitis is a complex condition that requires a comprehensive approach to care and management. With timely diagnosis and appropriate treatment, many individuals can recover partially or completely. However, the journey through recovery and adaptation to any residual effects of the disorder demands resilience, support, and informed care strategies.